Hello students, today we are going to learn about the meningitis. So itis means it is inflammation, it is one of the suffix. Meninges means we all know that it is covering of the central nervous system. So meninges, they have different layers, like from outside to inside it is dura mater, arachnoid mater and pia mater. So all these three layers of this meninges, they are covering the brain as well as spinal cord. So whenever you have inflammation of this meninges, the condition is known as meningitis. Now, in this figure, we can differentiate between the normal brain and spinal cord, okay, and the brain and spinal cord affected by meningitis. You can see on the left side, the tissue of the brain as well as spinal cord, they are normal, they are not infected. But in case of right side figure, you can see that brain as well as spinal cord, they are infected. Why? Because the patient is suffering from meningitis. And this meninges, they are in close relation with the superficial tissues of brain and spinal cord. So definitely the meningitis will not be restricted or confined to meninges only. It may spread to nearby tissue of brain as well as spinal cord. Now, let us start with the introductory part. So, the synonym for meningitis, it is leptomeningitis. Now, here the infection will be spreading by CSF, that is nothing but cerebrospinal fluid. So this infection will be spreading to pia mater, arachnoid mater, subarachnoid space as well as nearby superficial tissues of brain as well as spinal cord. Now there is one specific term that will be useful for involvement of the dura mater in meningitis, so that is known as patchy meningitis. Patchy means it is thick. Okay, so special term for dura mater involvement in meningitis. Now etiology. So which are the causes responsible for meningitis? So first of all, it is caused by wide variety of organisms, means multiple microorganisms they will be responsible for causing this meningitis, but they should be having capacity to cross blood-brain barrier and blood CSF barrier. Then and then they will be able to cause meningitis. Now, how this virus or bacteria will enter into the body, so that will be possible by contamination of CSF. Okay, so this CSF will be contaminated whenever individual has trauma to the head, so it is nothing but head injury. So whenever you have trauma, so microorganism will enter from this fracture site or from this wound, okay, and from that wound or fracture site they will be entering into meninges. Okay, sometimes this is also because of some medical procedures like ventricular peritoneal shunt. So during this there will be again micro trauma, and that will lead to entry of this microorganism into CSF. Now CSF, it is not just responsible for spreading the infection, but CSF will be also providing good ideal medium for growth of all this microorganism. Why? The reason is all body's typical major defense systems, they are essentially absent in normal CSF. So it is very favorable atmosphere for this microorganism to grow into this CSF. Now, depending on involvement of different areas of brain and spinal cord that is contaminated by CSF, patient will be having different neurological clinical features. So different meningitis patients will be having difference in their manifestation of clinical features. Now meningitis will be having two variants. One is bacterial meningitis and another is viral or aseptic meningitis. Now let us go in detail for bacterial meningitis. Now let us start with the introduction of this bacterial meningitis. So the acute bacterial meningitis denotes or shows infection caused by aerobic bacteria that may include both gram positive as well as gram negative. Now you know the difference between the gram positive and gram negative type of the bacteria. Clear? Gram positive bacteria will be stained as purple color and gram negative will be stained as pink color. So this basic difference we have considered. So in short, acute bacterial meningitis will be by aerobic bacteria. Now infecting organism. So here infecting organism will depend on age of population. Clear? Like all the virus, all the bacteria, they have some target population. For example, if you think of the polio virus, so the children below 5 years, they will be affected more. If you think of coronavirus, so the people more than 60 years, they will be affected more. Clear? So depending on the age of individual, the organism is also different. Now, if you think of neonate or older adult, so infection is mostly because of gram-negative enterobacilli, especially Escherichia coli and group B streptococci. Now, if you consider in children, so generally the organisms are H. influenza, Neisseria meningitidis, and S. pneumonia. If we think of young children, okay, and sometimes also adolescents and young adults, so meningococci, they are most commonly found to cause meningitis. Now, population at risk. So the individuals, those are suffering from sickle cell anemia or having any addiction to alcohol, or they are having confirmed diagnosis of diabetes mellitus, and especially that is also not under control, and any individual, he or she is having depressed immune system, okay, or underactive, okay, immune system. So these people, they are at more risk of developing this meningitis condition. Now, transmission. So how this transmission it is occurring? So it is a simple typical systemic route of bacterial infection. Clear? So generally it is by H. influenza microorganism. So first of all, there will be upper respiratory tract infection, and from this upper respiratory tract, the bacteria will enter into blood. Now, from this blood to CSF, how it is entering, it is not well established, or it is not well studied yet. So it is not proved, but it is proved that from upper respiratory tract infection, obviously there is nasal cavity, so it is open route for bacteria to enter inside. Clear? So from nasal cavity, it will be going into the upper respiratory tract. From upper respiratory tract, it is going into the blood, and from blood, how it is going to CSF, it is not well studied. Now, other routes, they are also available. So they may enter into the body from middle ear or mastoid air cells also. Another is as a complication of skull fracture. So definitely if there is skull fracture, so internal tissues, especially meninges, they are exposed to environment, okay, and sometimes also from nasal cavity. Now, if the patient is having fracture of cribriform plate of ethmoid bone, okay, so definitely there will be leakage of CSF, that is nothing but CSF rhinorrhea, leakage of CSF from nasal cavity. Clear? So again, that is establishing route of CSF from this subarachnoid space to directly environment. Clear? So by this way also, if you think of retrograde, okay, so by this, whatever the CSF is coming out of the ear, so bacteria will enter from ear, okay, because they have exposure to CSF. Okay, CSF is already available. So from that CSF is coming from inside to outside, but from this CSF only, this bacteria will enter into body from outside to inside. Clear? Now meningitis may be further complication, okay, of traumatic brain injury. So the person who is having traumatic brain injury, they can also get this meningitis as one of the complication. Now the spread of infection. So for that we have to understand the normal circulation of CSF. Okay, so we all know that CSF, it is produced inside this ventricles. We have two lateral ventricles, that is right and left, and then third ventricle and fourth ventricle. So how this CSF is moving? So first of all, CSF will be produced in two lateral ventricles. Okay, so that is right and left. From that, CSF is going into the third ventricle. From that, through the aqueduct of Salvius, it will be entering into fourth ventricle. Clear? From this fourth ventricle, it will be entering into subarachnoid space by different foraminas, okay, like foramen of Magendie and foramen of Leschka. So this is CSF circulation. Now obviously if the CSF it is contaminated, so by this way only it will be also spreading the infection to different spaces. Clear? Like in the different ventricular systems as well as subarachnoid spaces also. Now there will be obstruction of foramen of Monro, okay, aqueduct of Salvius, or exit foramen of fourth ventricle. Clear? So here, because of this blockage, because of this obstruction, CSF will not be able to go into subarachnoid space, okay, properly, or it is limited, okay, to subarachnoid space. So what is happening? There will be accumulation of CSF into this ventricular systems only. So what are the clinical features? As we discussed, CSF, it is not going properly for the circulation, so it will start accumulating inside this ventricles. Clear? So you can see in this MRI, so here it is normal ventricular system, that is nothing but our lateral ventricle. But as the CSF is not getting proper way to go outside from foramen of Magendie, foramen of Leschka, or from foramen of Monro, okay, or from cerebral aqueduct of Salvius, clear? So the CSF will be starting accumulated, and you will be having ventricular dilatation. So definitely, if the ventricles they are dilating, there will be compression of brain tissue, because this brain is compressed between the bony skull. So bony skull will not allow further passage for expansion to brain. Clear? So outside is limited, brain cannot expand outside. Okay, from inside the CSF it is occupying space. Clear? So we can say that it is like sandwich like structure, where the brain is getting compressed between the CSF from inside and bony skull from outside. Okay, so it is nothing but non-communicating or obstructive hydrocephalus. Hydrocephalus means there will be accumulation of CSF inside the brain. Clear? And this will give you symptom. Now, here what we have to understand that because of this there will be increased intracranial pressure, because CSF will be accumulated, so definitely it will be increasing your intracranial pressure. Now ideally whatever the veins those are available in the brain, okay, so these veins those will be responsible for draining the blood. Okay, so whatever the deoxygenated blood is there, that will be drained outside towards heart by these veins. But because of this increased intracranial pressure, this venous drainage is not proper. On the contrary, venous blood start getting accumulated inside the sinuses. Clear? So the amount of deoxygenated blood will also increase in sinuses. So that will further increase the intracranial pressure. Okay, so you have to imagine that there are sinus or emissary veins, those are carrying the deoxygenated blood. Okay, so this deoxygenated blood should be going to heart, but just because of increased intracranial pressure this blood is not getting proper pathway towards heart, so that will also start accumulating. Okay, so again there will be accumulation of fluid. Clear? That is nothing but venous blood, and this will again increase the intracranial pressure. So intracranial pressure will be by two factors. First, that is because of accumulation of CSF, as well as second factor, that is because of a lack of drainage of venous blood. Now, whenever you have increased CSF pressure, so what it will lead to? It will lead to decrease in cerebral blood flow. So now the new blood, that is arterial blood supply to the cerebrum, it is also affected. It is also reduced. Clear? So now brain is getting less blood. So just because the brain is getting less blood, what will be the change or what will be the compensation done by body? So body will try to increase the systemic blood pressure. Clear? So if the blood pressure is increasing, definitely the heart will be able to pump more amount of blood to the brain. Clear? So indirectly what is happening, there is rise in the CSF pressure, so that will lead to reduced cerebral blood flow. So just to compensate for this reduced cerebral blood flow, the blood pressure is increased by body to compensate or to give more amount of blood to the brain. So rise in CSF pressure will lead to increased systemic blood pressure. Now there will be a headache because of this meningitis. So what is the reason behind this, or what is the mechanism? So there is a stretching of this meninges as well as pain fibers associated with blood vessels. So because of the stretching, a patient will be complaining of headache. Now vomiting may also occur because of stimulation of emetic centers, those are situated in medulla. Now, papilloedema is also one of the sign for increased intracranial pressure. Then these are different clinical features. Patient will be having fever, but still hands and feet will be cold. Patient will be having vomiting, that also already we discussed. Patient has headache, stiff neck, so that is nothing but nuchal rigidity. So neck rigidity is not only symptom for meningitis, it is symptom for or sign for all the CNS issues. Then photophobia, so patient will not be liking the bright lights. There will be pain in muscle as well as joint. Patient will be drowsy, so it will be very difficult to make the patient wake up, and patient will be having confusion. Now, these are the list. So fever, severe headache, altered consciousness. There will be convulsions, especially in children. Convulsions means they are seizures, and nuchal rigidity. Now, nuchal rigidity, it is indicative of what? Okay, so it is indicative of irritative lesions inside the subarachnoid space. Now, there are few signs of this meningeal irritation. So definitely, as we discussed, nuchal rigidity, so that is nothing but painful cervical flexion, as well as Kernick sign and Brzezinski sign. Now, Kernick sign means what? So patient will be in supine lying position, hip and knee they are in 90 degree of flexion, and the knee will be extended passively. Okay, so the patient will be having stretching of meninges, and patient will be having provocation of symptoms by this sign. So it is suggestive of meningitis. Another is Brzezinski sign. So patient is in supine lying position, and the examiner will flex the neck. So because of flexion of the neck, there will be stretching of the meninges. So just to avoid the stretching of meninges, patient reflexly will flex the hip and knee. Okay, so that stretching of meninges will be lessened. So by this Kernick sign and Brzezinski sign, you can confirm the meningitis. Now, cervical flexion is painful. Why? So already we discussed, it is stretching the inflamed meningitis nerve roots as well as spinal cord. Okay, so it will trigger the reflex spasm of neck extensors. So that will be working as splinting. Splinting, what is the function of splint? What we are using in our patient to restrict the movement. Clear? So here the spasm of neck extensors, they will be working as one of the splint to prevent the further cervical flexion. Why? Because if the cervical flexion increases, it will also increase stretching of meninges, nerve roots and spinal cord, and it will increase the symptoms. But cervical rotation and extension movements, they are relatively free. Why? Because they are not stretching the meninges. Now, diagnostic criteria. Okay, so it depends on what? So it depends on two things or two categories. First is infecting agent. For example, if the infection is because of Haemophilus influenza, the condition will be known as Haemophilus influenza meningitis. If it is because of Streptococcus pneumonia, it will be known as Streptococcus pneumonia meningitis. Now, whether the condition is acute, subacute or chronic. Likewise, acute meningitis, subacute meningitis, chronic meningitis. Okay, so this is how it is categorized. Okay, or these are the criteria those are used for diagnosis. Now, diagnosis of bacterial meningitis can be established by blood culture. So simple blood reports will be done. Okay, and sample of CSF. So how this CSF will be collected for test? So that will be possible by lumbar puncture. CSF pressure will be always elevated continuously in case of meningitis, and when you check the CSF, so it will show that it has increased protein count and decreased glucose level. Okay, so that will further confirm the diagnosis of bacterial meningitis. For viral meningitis, the picture may be somewhat different, so that we will learn, but at present you remember increased protein count and decreased glucose level. Now, medical management. So various antimicrobial medicines or regimen appropriate to infecting organism. So based on the infection, okay, or based on the infecting organism, proper medicine will be given. Okay, so that will be possible to found by culture, okay, blood culture. Now, prevention. So the vaccination has reduced the incidence of meningitis, especially from H influenza type B, especially in population of young children as well as infants. Complication. So the type and severity of the sequel or complication depend on many factors. For example, area affected means which part of the brain or spinal cord that is affected, extent of CNS infection, whether it is more extent or less extent. Okay, based on that also complication will be different. Age and general health of individual. Okay, definitely it is affecting the prognosis. Level of consciousness when this medicine has started, as well as which pathological agent or which microorganism is involved in this meningitis. Clear? So based on all these factors, the severity of sequel or complication will be decided. Now, CNS complications will include subdural effusion, altered level of consciousness, seizures, those are known as convulsions, or there will be involvement of cranial nerves. Cranial nerves wise, mostly the 8th nerve is affected. Okay, 8th nerve, vestibulocochlear nerve. Other nerves may also be affected, but most commonly clinically it is found that 8th cranial nerve is affected, and there will be increased intracranial pressure. Now, results of long-term outcome or follow-up with this patients of bacterial meningitis, uh, it has shown that 20% of meningitis patient may have some residual neurological complications or lifetime neurological complications, while 80% can recover fully also. And what are these complications, that also we are going to learn. Okay, so you will be having cranial nerve palsy, especially as we discussed sensory neural hearing loss. Okay, so that is nothing but 8th cranial nerve, vestibulocochlear nerve palsy. So it is the one of the common complication. Now, in this population affected by meningitis, there are chances that there is ischemic stroke within first 5 days of meningitis. So it is possible that this patients of meningitis may get stroke. Now, you will be also having communicating hydrocephalus that will be clinically identified by problem in gait, mental status change, as well as incontinence. We have already seen the normal MRI and MRI of hydrocephalus. So hydrocephalus occurs because of excessive CSF accumulation, and that will lead to a compression of the brain. Okay, and clinically you will be having different neurological features. Now, 5% of the survivals may have lifetime weakness and spasticity. That is possible. Now, few cerebral signs will also be occurring as a part of complication, either early or late in the course of bacterial meningitis. That may include hemiparesis, so half side of the body will be weak, ataxia, that is lack of coordination, seizures, so that is involuntary contraction of body. Okay, seizures, they are nothing but convulsions, cranial nerve palsy, so as we discussed generally vestibulocochlear nerve palsy, and gaze preference, so that is nothing but because of extraocular muscle weakness or palsy. And cognitive slowness, it is found in 20% of the patients affected by pneumococcal meningitis as a complications. Now, location of damage. So here sensory and processing areas, okay, of brain definitely, as well as those areas typically characterized as belonging to motor system. So all these areas of the brain, they are affected, or we can say that these are the site of lesion. Now, in few patients there will be residual problems of perceptual deficit and regression means it is deterioration in cognitive skill, like before meningitis whatever the skill was there, it may regrade, okay, after this meningitis. So it is nothing but regression in cognitive skills. Now, cranial nerve involvement, that is already we discussed many times, okay, it is expressed as dysfunction of 8th cranial nerve. Okay, so definitely it is affecting hearing as well as balance. So auditory as well as vestibular deficits will be found as a complication in our patients of meningitis. Now, aseptic meningitis, so that is second type of meningitis. Till now we learned about the bacterial meningitis. Now we are learning the viral meningitis. It is also known as aseptic meningitis. Now let us start with the introduction. So it is non-purulent inflammatory process confined, that is restricted, confined or restricted to the meninges and choroid plexus only, usually caused by contamination. Contamination means it is infection, okay, infection of or contamination of CSF with viral agent. Okay, so aseptic meningitis, it is by viral agent. Now, the symptoms will be similar. So, if you are asked in exam for aseptic meningitis, okay, or viral meningitis, the same symptoms you have to mention here also, whatever you have explained in your bacterial meningitis. But here, the severity will be less. So, viral meningitis will be having less severity as compared to bacterial meningitis. Now, individual affected by this meningitis may be irritable and lethargic. Okay, lethargic means inert, okay, inactive, okay, and may complain of headache. Okay, why the headache occurs? The reason is very common, that is because of stretching of inflamed meninges. Okay, but the cerebral function, they are remaining normal, okay, unless and until there is some serious complication. So here it is the good part, that brain tissue and spinal cord tissues, they are affected less, so the cerebral function remains normal. Now, aseptic meningitis of viral origin, okay, usually causes benign and relatively short course of illness. So the patient will be recovering earlier as compared to bacterial meningitis. So we can say that the duration or course of illness will be less, relatively less. Which are the causes? So most common causes are enterovirus, okay, so that includes ecovirus and coxsackie virus, as well as it may be possible by herpes virus as well as human immunodeficiency virus. Now few non-viral causes are also there, so this include Lyme borrelia as well as leptospira infection. Diagnosis is by isolation of infecting agent within CSF. So this organism will be growing inside CSF only. So by this CSF sample, this microorganism will be isolated by test, okay, in pathology laboratory. So it will confirm the diagnosis. Then what will be the difference between this bacterial meningitis and viral meningitis by testing? So here it is explained. Glucose level in CSF in bacterial meningitis is usually reduced, but in case of viral meningitis, glucose level is not reduced. Okay, so it is maintained, it is normal. Clear? So if the glucose level is reduced, it is bacterial meningitis. If the glucose level is not reduced, it is viral meningitis. Now, management of symptoms, generally whatever the symptoms are there, those should be treated, okay. And generally this condition, that is aseptic meningitis or viral meningitis, that is not typically producing any residual neurological sequel. Residual means permanent, okay, lifetime. Neurological, we know. Sequel means complication. Clear? So generally once the patient is recovering, there will not be any residual neurological sequel or lifetime neurological complications. Full recovery, it is anticipated within a few days to few weeks. Okay, exact time we cannot predict, but it will be within few days to few weeks. This whole lecture is prepared from UMFAT Neurological Rehabilitation. So for more details, you can refer this book. If you have any question, you can ask. Thank you.